Hello everybody, this is Alex from SoyaCincau.com and this is a COVID-19 Vaccine Malaysia update, and we're back for a special episode to cover the COVID-19 vaccine booster program as well as a new Omicron variant that has been detected in Malaysia. Just a friendly reminder that this update is also available in Bahasa Melayu, and you can check it out on our SoyaCincau BM channel by clicking on the pop-up above or click on the link in the description box below. Malaysia is currently administering the booster dose to eligible individuals, with priority given to senior citizens as well as individuals with comorbidities. Some of you might ask, why do you need a booster when you've been fully vaccinated with 1 or 2 doses of the COVID-19 vaccine? Based on data, the protection against COVID-19 weighs over time, and the booster ensures that you have optimal levels of protection. According to the real-world evaluation of COVID-19 vaccines in Malaysia, the protection levels against infection for Pfizer drops from 89% to 68% after 3 to 5 months. However, for Sinovac, it drops from 76% to 28% in the same period. Meanwhile, for ICU admissions, protection with Pfizer dipped slightly from 86% to 79%, while Sinovac dropped from 55% to 28%. Both vaccines are still effective at preventing death due to COVID-19 at 91% and 76% respectively. The COVID-19 booster vaccine appointment will be sent out automatically via MySejahtera or by SMS. You can check if you have an appointment by going to the MySejahtera homepage, tap on COVID-19 vaccine, and then tap on your name and then scroll down. The technical working group of the COVID-19 Immunisation Task Force has revealed the full schedule for recommended booster shot based on the vaccine that you've received. If you've been fully vaccinated with Pfizer, it is recommended that you get the booster 6 months after the second dose. Pfizer is the recommended booster, while AstraZeneca is permitted for people aged 50 years old and above. For individuals who have gotten the AstraZeneca vaccine, it is also recommended to get the booster shot 6 months after the second dose. AstraZeneca is still the recommended booster shot, and Pfizer is also permitted as an alternative. For those who have gotten Sinovac, it is recommended that you get the booster shot 3 months after the second dose. The recommended option is Pfizer due to its higher efficacy rate. For those who are allergic, you may get AstraZeneca or Sinovac instead. For all other vaccine types, the booster interval varies from as little as 2 months for Johnson & Johnson to 6 months for CanCino and Moderna. The recommended booster for these vaccines is also Pfizer or AstraZeneca as an alternative for individuals aged 50 years old and above. During a recent interview with Astro Awani, Health Minister Khairy Jamaluddin has revealed that only a small number of people had serious side effects after getting the Pfizer COVID-19 vaccine booster jab. Out of 1.7 million Pfizer booster doses administered until the end of last month, there are only 11 cases that are considered as serious. That's equivalent to 0.00065% of total doses administered. He said most of these serious cases involve allergies and they don't require hospital admission. In case you're wondering, Khairy has also received the Pfizer booster dose after being fully vaccinated with 2 doses of the Sinovac vaccine. For individuals who have yet to get vaccinated, local data has shown that the risk of death due to COVID-19 among the unvaccinated is 35 times higher compared to those who are vaccinated. This data was shared by Dr. Mahesh Appanan, the head of data at the Crisis Preparedness and Response Center at the Ministry of Health. According to the COVIDNow website, only 1.5% of the total adult population in Malaysia have not yet gotten a single dose of the COVID-19 vaccine. But in the last 2 weeks, 36.4% of the COVID-19 deaths are from this small portion of the population who are not vaccinated. This shows that the risk of deaths due to COVID-19 is much higher if you're not vaccinated. Protect Health, the entity under the Ministry of Health which handles the booster program for private clinics and hospitals, has assured that all booster vaccines are offered for free under the National Immunisation Programme. In a recent statement, he said that the Sinovac booster vaccines are limited and is prioritized for people who have allergies or can't take the Pfizer vaccine. For those who don't have allergies but still prefer Sinovac as the booster shot, it is available for purchase at the private clinics. If you prefer Sinovac over Pfizer, you're urged to contact the vaccination center early and to inform them of your choice before your appointment. B.1.1.529, or better known as Omicron, is a new COVID-19 variant of concern which was first reported to the World Health Organization on the 24th of November 2021. What makes it different is that it has over 50 mutations, which raises concerns among scientists and health authorities. At the moment, scientists are still studying the new variant, and it isn't clear if it's more severe or deadlier compared to the current Delta variant, so it's still too early to tell. Despite Omicron being first detected in South Africa, there's no evidence that it originated from that country. At the moment, there are more than 30 countries that have detected Omicron, including Malaysia. Following WHO's announcement of the Omicron variant, Malaysia joined other countries in imposing travel restrictions to 7 African nations on the 26th of November 2021. Early this week, WHO reported no Omicron-related deaths among the 38 countries with cases of Omicron. As scientists continue to study the new variant, WHO advised everyone not to panic and to take necessary precautions. And Omicron won't be the last COVID-19 variant of concern, and we can expect more to emerge as long as there's still a large unvaccinated population worldwide. Hence, it's important for the COVID-19 vaccines to be distributed fairly to all countries, including poorer nations. Last week, Malaysia reported its first Omicron case involving a 19-year-old foreign student that's studying in Perak, but many were not aware that this is actually an old case, and it's not a new import case after Malaysia implemented more stringent travel restrictions. As shared by Kari, the first Omicron case was discovered after genomic tests were conducted on positive cases that were detected at KLIA between the 11th to 28th of November 2021. The student arrived from South Africa from Singapore on the 19th of November, which is before the first Omicron case was reported to the WHO. Like any positive COVID-19 case, the student and her close contacts have to undergo quarantine. She has completed her 10-day quarantine on the 29th of November and she was asymptomatic. The Ministry of Health had called the student and her 7 close contacts back for another PCR test on the 3rd of December, and the results have returned negative. So far, this is the only Omicron case that's reported in Malaysia, and how fast we can detect more is dependent on our genomic sequencing testing capacity in the country. To curb further spread of the Omicron variant in the country, the Ministry of Health has announced new measures for incoming travellers. Travellers coming in from countries with cases of Omicron, such as the US, UK, Australia, France, and Norway, have to wear a digital tracking device during the quarantine. On top of that, travellers that use the vaccinated travel lane must undergo PCR tests 48 hours before entering the country. The Ministry of Health has also advised all senior citizens as well as individuals with comorbidities to delay their plans to travel overseas following the discovery of the Omicron variant. For Malaysians travelling overseas, you're advised to follow the Malaysia SOP, which includes wearing a face mask. Kari said this as other countries have a lax attitude against these safety measures, and it is important to follow the SOP to minimize the risk of infection. Omicron or not, it's important to follow the SOPs, including wearing a face mask and to social distance. If you have received your appointment for your vaccination or booster, don't miss it. The COVID-19 vaccinations has helped to bring down the number of new cases, hospitalizations and deaths while allowing the country to reopen safely. And if you're travelling interstate to Balai Kampung or to go for events, it's recommended that you go for a COVID-19 self-test. The self-test kits are now quite affordable. You can get one for less than 5 ringgit. So take care and stay safe. And if you have any questions, please drop them down below and we'll try to answer them as soon as possible. If you like this video, please give us a thumbs up, like us on Facebook, and don't forget to subscribe us on our YouTube channel and hit the notification bell icon so that you'll be informed of our future videos. This is Alex from SoyaCincau.com. Thank you so much for watching and we'll see you in the next one. Bye!